Hello and welcome to our final presentation of the semester. This is Alexa, Kaylee, and Bree presenting on prenatal care. The idea of whether or not the utilization of prenatal care during pregnancy is necessary has had a severe impact on the debate that soon-to-be mothers have wondered about for many years. It's argued that due to a lack of resources, knowledge, or other barriers in the healthcare system, that prenatal care has not been an essential aspect of pregnancy for all soon-to-be mothers. But there's also an element of correlation that exists between the health outcomes of infants after delivery with whether or not the mother chose to apply any type of prenatal care during her pregnancy or none at all. As we take a look at this debate some more, our research question aims to answer whether or not adequate and consistent prenatal care increases health outcomes in infants when compared to those whose mothers received minimal to no prenatal care at all. Our methods included an extensive research process through databases such as NCBI and Google Scholar, which helped us to refine our search and find credible articles that were relevant to present-day information, as well as what we might already know about some of these topics. Some keywords we used that were important in this search included prenatal care, infant mortality, and infant health outcomes. Overall, the research studies have found that there is an increased likelihood of negative health outcomes in infants whose mothers have received little to no prenatal care throughout the duration of the pregnancy. But it's important to consider the factors that are influencing or inhibiting those mothers' receival of adequate care, which may include areas such as health insurance, education, income or relationship status, substance abuse, or poor health. So it is thought that by raising awareness and bringing light to education on this research, implementation of change will be achieved by providing resources and better access to prenatal care to the demographics proving to be most in need. And this would help to decrease the risk of adverse health outcomes in both mothers and babies.
Okay, so moving on, we are discussing the objective and purpose of this presentation, which also aims at discussing the PICO question that we were going to try to answer through our literary research analysis, our PICO paper, and through this presentation. So our question that we focused on was, in pregnant patients, does receiving consistent and adequate prenatal care increase the likelihood of positive health outcomes for neonates or infants when compared to similar pregnant patients who did not receive any prenatal care on a regular basis? So in our literature review, we reviewed several articles. So in the article, Inequalities in Utilization of Prenatal Care, a population-based study in the Canadian province of Manitoba, is a study about prenatal care utilization in pregnant women. It also goes into detail about the personal aspects of why some people choose to use prenatal care and why some women are not able to receive or utilize prenatal care. Another article that we utilized for this presentation was the Association of Inadequate and Intensive Prenatal Care with Maternal, Fetal, and Infant Outcomes, a population-based. It was based in the same province of Canada. It's similar to the article mentioned above. However, it goes into more detail about infant outcomes over the reasons as to why mothers may not receive adequate prenatal care during their pregnancy. The article explains that there is an increased risk for stillbirth, preterm birth, low birth weight, small for gestational age babies, admission to the NICU, postpartum depression, and anxiety disorders in short interpregnancy intervals to next birth when prenatal care is not utilized for the duration of the pregnancy.
Adding to that literature review, the third article we used is called State Approaches to Ensuring Health Pregnancies Through Prenatal Care. This article discusses what prenatal care is, disparities in prenatal care, the risk of not receiving prenatal care, and some solutions to the problem. The article talks through the Affordable Care Act, federal health agencies, and pregnancy risk monitoring that have been made available to women to get them better help and access to prenatal care to reduce the most commonly associated risks mentioned above. Current literature supports the idea that change is ready for implementation in the United States. Studies from the U.S. and Europe found that a lack of health insurance was an important risk factor for inadequate prenatal care. In conclusion to all of this, by using research which supports increased numbers of positive health outcomes for neonates whose mothers receive prenatal care, we can help to provide education and promote maternal fetal well-being, as well as decrease incidences of negative health outcomes, including but not limited to developmental delays, low birth weight, breeding difficulties, feeding difficulties, and stillbirths.